Okay, so looks like we've peaked around 92, so we'll jump in with this. So I wanted to, in fact, Heather, why don't you start, because this is important, and especially for our social work colleagues, there's new information. I know you've said it once, but it's always worth repeating. So you do the, I'll do the wrap up. I want to make sure that Jeff Schiff is in the on deck circle, because I'm going to ask him to say a few words about the upcoming SAG. But Heather, first you.
Sure. So for requesting continuing education credits, we are now eligible for social workers, RNs, NPs, MDs, and PAs. I just shared the attendance Google Doc sheet in the chat. I will also send it out through email again at the end of the day. So what you need to do is put your information on the attendance Google Doc, fill out the evaluation. I just also sent that link out through the chat, and we'll send that out through email. So fill out the Google Doc, complete the evaluation. You will then, in the next 1 to 2 weeks, get an email from Boston Children's CME department with an additional miniature evaluation about today as well. Once you complete that, you will then be able to access your certificate on the Boston Children's Cloud CME website. Instructions will also be sent to you in that email that gives you the evaluation for how to make your own account and how to access all of your certificates in one special place. So if you have any questions or if you're having any trouble, feel free to email me. Thank you, guys.
Thank you. And so I know that we changed things up a little bit today. We'll be very grateful to see what you think of the evaluations. We purposely tried to do some cross team collaborative effort. But please be brutally honest with us. What we don't know can't help us. But let's talk a couple minutes about where we were. I wanted to reinforce the notion that I don't want you to think operationally or strategically any different about children with medical complexity than kids with special health care needs. And remember, complexity is not just medical. It is health, which means social determinants are in scope. So for those of you that were really struggling with the notion of tiering, how to do it when, don't make the leap all the way into risk stratification and risk adjustment. Start small. What can you assess within those domains of the social determinants, and then go forward. Second takeaway point, integration is crucial. The medical home, wherever you are, you don't have to own everything. You may not even have to own the screening, but you need to play a role in it. So think about this approach to strengths assessment and needs assessment and the formulation of an integrated care plan of care as to what's my role in the overall team, and can the family tell that there is a team and that we're working together. So think integration. We've offered you a validated instrument for checking that. Track the activities that are supporting the needs assessment. Track the activities that are supporting referrals and liaison to community partners and the like. Those are the value stream. Those are the things that are not billable in face-to-face encounters. And if you don't measure it, it's never going to be paid for. We recognize fully that various members of this academy are at varying degrees of fee-for-service versus value-based contracts. I think it's pretty clear that value-based care is not going to go away. The Care Coordination Academy needs to demonstrate very quantitatively, this amount of care coordination takes this much effort, and look at this. So thinking about Stacy Cook's idea that the numbers of visits were going down over time, or for those of us that are either providers of care or families on the receipt side of that care, doesn't it make sense that when you're thinking prospectively that you need less unexpected care? But we can't just simply celebrate, oh, look, kids are being seen less. You got to say, but the intervention for that was family engagement. It was a care plan that somebody is curating, and there's integration across these sectors: education, social, medical, et cetera. And I think those are some of the takeaways for today. And I'm going to say one other thing and then bridge to my dear friend and colleague, Jeff Schiff. This is not a one and done. We literally could spend the next couple of years talking, getting from tiering for the sake of strengths and needs assessment for resource allocation to risk adjustment with implications for payment. We're not going to do that all, even in the next couple of months. But through our SAG, the Sustainability Affinity Group, we're going to lay the groundwork for how these things connect with each other. So I'm going to hand it over to Jeff to continue to provide that commentary. What does that conceptual line of sight look like for us, Jeff?
Thanks, Rich. And I guess what I want to start my comment by saying what's really cool is I feel like we've created a community of all learn, all teach here. And that's really pretty awesome, because there's no Rich and I, well, Rich might have some magic that he can impart, but I think all of us are really just working through this one step at a time and incrementally trying to move it forward. I want to just say that our next SAG, the Monday, the third Monday of the month is MLK. So we hope that you all take off to honor Dr. Martin Luther King's legacy. We will not, where our SAG is the following day at 3 o'clock Eastern, 1 o'clock Mountain Time. And we're going to pick up on this tiering conversation, hopefully in terms of how to incrementally implement tiering. One of the things I think I'll say then, but I'll say it now too, is that we need to have the right amount of precision to engage Medicaid, but we don't need to have so much precision that we kill ourselves. Because I think that as Stacy so nicely said, patient complexity changes, and as someone said in our session on finance, attribution changes as well. So we're going to pick up on tiering and continue this conversation on the 19th, and hopefully we'll give each other ideas about how to move that forward one step at a time. And then I just want to say that I think we need a separate conversation related to tiering, because it's such an important issue around some of the social complexity. So we want to talk about both sides of this as well. So I don't want to miss that opportunity, and we'll work on that as well. With that, I think I'm going to turn it back to you, Rich, or to Heather, because I will hopefully see you guys in about a week.
Another pearl that I'd like to share, and then Heather, I'll let you bring us home here and close us out. And because I've been quickly tracking the chat the last couple of minutes. So the Florida team talked about transition, and I completely agree with this. So you'll notice that there's a reason we haven't had a transition session yet. And this is something that many of you may know I've been at for decades, but here's what I've learned. To begin the process of care integration, defragmentation around the time of transition is not fair to the patient, to the family, to the caregiver unit, or to our adult care colleagues. And so we need to demonstrate what an integrated, defragmented care team looks like and functions like. And I can tell you, we already have some pockets of activity where adult organizations are asking to join. Here in the Boston area is one of those locations. So we're not going to forget about pediatric to adult care transitions, but we're going to do so in a way that one concept builds upon another. And then finally, everything we said today in the small session on tiering, and what I hope you heard from Stacy Cook, is care integration and value apply whether you are a frail elderly or whether you are a recent NICU graduate. So I want to encourage the team to be looking at those themes that cross the age spectrum. And I don't mean transition peds to adult. I mean when you and your respective teams are talking with CMS, talking with your state Medicaid program to be able to promote, these are the necessary resources for care integration. I want that Medicaid director and her or his staff to hear, oh, wait a minute. This also applies to our 64-year-old beneficiaries, doesn't it? In addition to the kids. Now, the content within care integration applies and is very different, right? Between children, infants, children, adults, et cetera. But the framework of performance and performance measurement is by design pretty stable, and we'll continue to hammer away at that as we move forward. Once again, I want to express the gratitude of Meg Camo, who couldn't be with us physically today, but her spirit is here. And thank our BU team, in particular, Jessica Flaherty, Beth Lynn, Virgo Houlihan, Libby Ethier, who was with us at the beginning. Heather, huge thanks for pulling this off. The baby's very first Christmas holiday season, and somehow you managed to just pull this off. And then for all of us emotionally, after the events of this week, we have our work cut out. Please don't feel at all disillusioned. If anything, I want you to close out today's session by saying our efforts are more needed now than ever before on the assessment side, the advocacy side, the measurement side. This country, the children and the families need this, and I am honored to be part of this academy. So Heather, I'll hand it to you and you can close us out.
Yes, thank you so much, Rich. I echo everything that you said. Thank you to everyone. I hope you enjoyed the day. Please complete the evaluation. And as Rich said, please be honest. It only helps us make the day better for you and helps your learning. Thank you to everyone for your patience with the new breakout structure. I think, we're learning the process too, and we hope as we continue to get everyone to update their Zoom, it'll be a more robust process. And I will give a little bit more detailed instructions probably at the next session about how to self-select breakout groups. I think some of us have different screens based off the Zoom that we're using, so it might not be perfect, but I think it's a work in progress. So I really appreciate everyone's patience. I hope you had a great day. I won't take up too much more time of your Friday afternoon, but it was nice to see everybody. Happy New Year, and we will see you for the SAG on January 19th.
Take care.
Bye, everybody. Thank you.
Bye-bye.
Thank you.
Thank you, everybody.
All right, team, are we staying on? I know last time I left, but there was a discussion. I'm happy to stay on for a few.
I have to jump shortly. I do have a 4 o'clock interview that someone put on my calendar.
Yeah, and I have a 4 o'clock as well.
Okay, so we no secret discussions.
Just
We're all out.
Just to reinforce with you, wonderful friends and colleagues, this morning was a conversation about spreading our tools across Canada. Then we had this, and my 4 o'clock is actually a team between France and Italy. So
Wow.
there is a lot of wind in our sails, and I'm going to have to pivot. But truly, sincerely, thanks to every one of you guys. Beth Lynn in particular, please let Meg know that she was top of mind, and we'll look forward to next steps. So thanks, everybody.
All right, thank
Awesome.
you, guys.
Bye-bye.
Jessica, we'll talk again, of course, but I think whenever the recording at some point, you can send it to me and I'll upload it to Open Pediatrics, but no rush on that. I know it takes a while to load up with how long it is.
Yep,
So
absolutely.
thank you for being amazing today, everybody. We'll
Thank
see
you,
soon.
everyone.
All right.
Good
Be well.
weekend.
Happy weekend day. Yeah.
Yes, thank you.